I believe that it is best that you, mom and dad, can recognize hand, foot, and mouth disease in kids. Well, hand, foot, and mouth disease is common in infants and young children, those less than 5 years of age. And though most kids have mild symptoms for 7 to 10 days, it is also important that you can recognize it, know when to worry, know when to call the doctor. In this video, we will talk about hand, foot, and mouth disease. What are the causes? What are the signs and symptoms? When should you worry and call your doctor? What are the possible complications? How to treat it? And most importantly, how to prevent it? Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to empower you, moms and dads, in order to raise happy and healthy kids. Hand, foot, and mouth disease. Hand, foot, and mouth disease is contagious, and it is caused by viruses. So it can spread from an infected person's virus to other people. This is through the infected secretions from the nose and throat, like the saliva, drool, and nasal mucus. It can also spread from fluid from the blisters and also from a person's feces or poop. As was mentioned, the spread of hand, foot, and mouth disease is mainly through contact. So from contact from an infected person's cough or sneeze. Close contacts are also at risk from kissing, hugging, sharing of cups, or using another person's utensils. Touching feces or poop is an important risk factor. So an example would be when changing a poopy diaper and then touching one's eyes, nose, and mouth. And surface contact is another possible spread. For example, when the virus is on the surface of toys and then you touch the eyes, nose, or mouth. And in rare cases, the virus can spread through contaminated swimming pools, contaminated by feces, which has not been properly chlorinated. Hand, foot, and mouth disease is caused by viruses that belong to the enterovirus family. The most common is the Coxsackie virus A16, commonly causing hand, foot, and mouth disease in the US. Another virus is the Coxsackie virus A6, also a common cause of hand, foot, and mouth disease and may cause a more severe form of disease. And another form is the enterovirus 71, a cause of outbreaks most commonly found in East Asia and Southeast Asia, and can even be more severe and can cause encephalitis, which is a form of infection causing brain swelling. Now, the signs and symptoms of hand, foot, and mouth disease. Fever and flu-like symptoms usually show up about 3 to 5 days after catching the virus. So the child may have fever, you may notice your kid to be eating less or drinking less, complaining of a sore throat, and feeling generally unwell. Mouth sores is a common sign which can be painful for your child. It usually starts out as red spots on the tongue or around the mouth, which can blister, and this can cause pain. Signs that your child is suffering from mouth sores: if your kiddo is refusing to eat or drink, if your child is drooling a lot and would only want to drink cold liquids. A child with hand, foot, and mouth disease can get a skin rash, especially found on the palms of the hands and soles of the feet. Other locations can be in the child's buttocks, legs, and arms. It is not usually itchy. It can appear flat or slightly raised. And some kids may have blisters. The fluid in the blisters contain the virus. And later on, the blisters would scab as it heals. It is important that you keep the blisters clean and avoid touching it. How do doctors diagnose hand, foot, and mouth disease? Well, your doctor would examine your child and check for the appearance of the rash while considering your child's other signs and symptoms. There are times where the doctor would request for a sample from your child's throat or feces and send these to the laboratory to check for the virus. But these tests are rarely done. When should you worry and let your doctor know immediately? So you should worry if your child is not drinking enough. That might be a risk factor for dehydration. You should also worry if your child is not alert, if your child's fever has lasted for more than 3 days, if your child's having signs and symptoms for 10 days and is not improving, if your child has a weak immune system, and we should worry that your child might have severe symptoms if your kiddo is very young, especially those who are less than 6 months old. Hand, foot, and mouth disease does come with complication. A complication that can be common is dehydration, especially in young kids who are not swallowing or drinking enough liquids because of the painful mouth sores. Try to prevent dehydration by making sure that your kid is drinking enough fluids. Signs of dehydration that you should worry about: if your child is weak appearing, has sunken eyes, and has less wet diapers. Another complication are fingernail or toenail loss. Although these are very rare, some kids may lose a fingernail or a toenail, which can happen after being sick from hand, foot, and mouth disease. But the nail would later grow back. Another complication is viral meningitis. This is very rare and can occur in a small number of kids. Viral meningitis causes symptoms of fever, headache, stiff neck, and the child may need to be hospitalized. And another very rare complication is encephalitis and or paralysis, which causes brain swelling, and for paralysis when the child is not able to move parts of the body. It is important that we should know how to prevent hand, foot, and mouth disease. It is important that you should wash your hands with soap and water for at least 20 seconds. If soap is not available, you can use an alcohol-based sanitizer. When to wash your hands, especially after changing the diaper, after using the toilet, after coughing or sneezing, and before or after caring for somebody sick. I encourage you to help your child wash his or her hands as well with soap and water. And remember to clean frequently touched surfaces like doorknobs and toys. If your child is sick, avoid sharing of cups and utensils. And also, if your child is sick, avoid hugging, kissing, or other close contact. How do we treat hand, foot, and mouth disease? Well, there is no specific treatment for hand, foot, and mouth disease, but we can take steps first to relieve your child's symptoms, and secondly, to prevent dehydration. You can buy over-the-counter fever or pain medications to make your child feel more comfortable, such as acetaminophen or paracetamol or ibuprofen, so that your child would feel more comfortable and would have some pain reliever for the mouth sores. It is important that you should not give your child aspirin. Then, make sure your child drinks plenty of fluids to prevent dehydration, as much as he or she can take. How to go about school or daycare? If your child has hand, foot, and mouth disease, it is important that you should let the teacher or the daycare personnel know so that they would know what symptoms to watch out for. It is recommended that you let your child stay home until he or she doesn't have a fever and the mouth sores and the blisters have completely healed. Hey, if you liked this video, watch my next video where I teach you about other child health problems.